You're watching CTOM TV. Knowledge is power.
There's a new class of drugs called immune therapy, and immune therapy is really the key to cancer longevity and what we call long-term durable remissions, also known as cures for certain people. So basically, what happens in cancer is the immune system is shut down, and there's about there's probably 11 or 12 different signaling pathways or signaling cascades that we know of that tumor cells use to shut the immune system down. And the reason they do this is for two reasons. Number one, tumor cells and the immune system use the same foods. They use the same growth hormones. So when an immune system is in the tumor microenvironment, it causes inflammation, and the tumors feed off of that inflammation. So inflammation is basically the immune system gearing up to fight an infection. The actual inflammation is the immune cells in an area of infection, and the immune cells release all of these growth factors to cause amplification of the immune cells in the area of the infection or the area of the tumor, which is the same thing. And then what happens is, in the case of cancer, the cancer shuts down, waits for these tumor cells to produce all these proteins and foods and growth factors, and then it shuts them down and feeds off the foods they've supplied. So right now we have two well-established immune treatments, and they work on two of those 11 pathways I mentioned. There's actually a third one, but the first one is called PD-1. It's called Programmed Death 1. And then the other is called CTLA4. And so we have a bunch of different PD-1 inhibitors. We were the first company to use them in Canada. And we used them on a woman with metastatic melanoma who literally had months to live. She had tumors all over her body. She did 4 shots of a PD-1 inhibitor and 4 shots of a CTLA4 inhibitor. And it just eradicated all of her tumors, and she's still cancer-free to this day. So if you're looking for a cure, immune checkpoint inhibitors such as PD-1 inhibitors and CTLA4 inhibitors are the closest way of doing that. Since then, we've got all kinds of examples of patients that were on death row, and they're completely cured now. So you get durable long-term responses typically from PD-1 inhibitors. It's not always the case. So the big problem with these drugs is determining whom is going to benefit from them. And so we have a whole checklist of genetic features that we look at that help determine, the percentage of a chance of you responding to either a PD-1 inhibitor or a CTLA4 inhibitor. And so these drugs are available in Canada. They're approved for certain cancers, but they're not well distributed. But you can pay for these drugs out of pocket if you want to. So what I call the lottery card, when you get your tumor DNA sequencing, you have something called high tumor mutation burden. And that refers to how many mutations you have per million base pairs of DNA. So high tumor mutation burden is referred to as having 10 or more mutations per million base pairs of DNA. So, sometimes we'll see patients with 250 base pairs or 250 mutations per 10 million base pairs. And those patients have exceptional responses to these drugs. So this is another reason to get tumor DNA sequencing, because that's reported. You get your tumor mutation burden. You also get something else called MSI, which is microsatellite instability. And you also have something called mismatch repair. All of these can indicate whether immune therapy or PARP inhibitors will be beneficial for you. So a really good reason to get tumor DNA sequencing.
Thank you for watching CTOM TV. Subscribe below and stay informed.